Ethics of suicide. Among its many but similar definitions, suicide is defined as a voluntary and intentional act of taking your own life. Many people, like J.L. Worth, think that suicide is morally justifiable if it is chosen rationally. But what is rationality? Must it be reasonable or must it be logical? According to philosopher Immanuel Kant, suicide is always irrational because suicide is treated as a means to end oneself rather than as an end in oneself. In most discussions, rational suicide is associated with reason, a word that is linked with practicability and sensibility. But logical reasoning deals with premises and the ability to draw conclusions from them. So are experts right about determining rational suicide by reason? I will show that rational suicide is impossible, therefore all forms of suicide are morally wrong. There are several premises that Worth uses to determine rational suicide. To what extent do these premises actually follow through? The first premise says a suicide cannot be rational if a person is under pressure to commit suicide. In other words, if a person is coerced, it is not a rational suicide. How do we know when a person is coerced? How can we determine a coerced suicide? If coercion is the influence from outsiders to make a decision, then how is the influence we attain from our culture and environment any different? We are all inevitably and unconsciously inspired by the values of those close to us. Therefore, suicidal values of that particular culture will influence those who live in it. So up to what point does that influence become coercion? Suicide is often described as an ambivalent matter. In other words, people who are suicidal don't have the mentality of making a decision. Expert Schneidman describes that a prototypical suicidal state is one in which an individual cuts its throat and cries for help at the same time. Therefore, if rational suicide is committed by a person who is capable of making decisions, then rational suicide is impossible. The second premise says that suicide cannot be rational without an assessment of mental competence by a mental health professional. This implies that if a person is incompetent, then suicide is not rational. Competency is defined as having suitable skill, knowledge, or experience for some purpose. Therefore, a suicidal patient is likely to be incompetent because an incompetent person does not have the skill to make a decision. This premise also fails to define a mental health professional. Mental health professionals can only make educated opinions respecting competency. These experts can include a nurse, a psychiatric aide, social worker, or a psychologist. Therefore, training and experience for a professional should be determined in order to estimate a person's competency. The third premise says that suicide cannot be rational if a person has treatable major depression. In this case, it fails to define what major depression is. According to the Diagnostic and Statistical Manual of Mental Disorders, a person who suffers intense mental anguish, profound suicidal intent, powerful self-hate, and severe insomnia would not be considered having major depression because the person lacks the additional symptoms defined by the Diagnostic and Statistical Manual of Mental Disorders. Another unconsidered question is, what is an untreatable depression? Everybody responds differently, so what might work for someone, it could partially work for someone else, or it could not work at all. The fourth premise states that suicide cannot be impulsive. In other words, all alternatives should be considered. But how can a suicidal person consider all other choices if people who are suicidal don't have the mentality of making a decision? The idea that suicide is ambivalent comes back to play. People who are suicidal go from having many choices to one. Therefore, people who kill themselves must have been unambivalent about it. There are many more premises that fail to follow through because they present an unclear statement. These premises are based on reason with a weak connotation of inductive and deductive thought. Labeling a suicide as rational only helps the people affected gain some sort of closure. It is an attempt to understand the person's decision to commit suicide, and it is an attempt to prevent future patients to committing suicide. But Kant emphasizes the duty to respect every individual's autonomy. Respecting autonomy implies that one respects others' right to act according to their beliefs, where those beliefs do not themselves disrespect autonomy. Therefore, suicide is irrational because it treats oneself as a means to end rather than as an end in oneself. Allowing reason to determine the rationality of a suicide requires the premises to be accepted. Truth of the matter, some of these premises can be accepted by some and rejected by others. Logic does not require premises to be accepted. It does not rely on ethical or moral assumptions or development of a general idea. It simply deals with a premise and its ability to draw and effect a conclusion. So treating suicide as a rational act under these ambiguous premises compromises the idea of respecting autonomy, and it fails to follow a premise. Thank you.